I'm joined today by Dr. Lawrence Lowe, Peel's Medical Officer Health, Paul Morrison, our Commissioner of Legislative Services and Director of Bylaw Enforcement, and additionally Councillor Rowena Santos. I want to start by acknowledging how encouraging it has been this week to see appointments opening up. The move on Monday at 8 a.m. to allow those over 18 to book vaccine appointments has been met with great encouragement. There has been long queues to sign up for vaccines because people understand that getting a vaccine protects their friends, family, and their community. And for a long time during this pandemic, I was getting emails from mothers and fathers, husbands and wives concerned about a loved one working in an essential workplace. The average age of an essential workplace is 36 in Brampton, and so there's a lot of people that did not meet the age threshold before when it was 45 plus. And so, you know, those worried emails, it was something that kept me up at night because I know there was so much worry in our community. To know that all those workers are now eligible to book a vaccine appointment is just such good news. And, you know, for the first time in the last year, I really feel optimistic about the road ahead. If you want to book your vaccine appointment, please visit ontario.ca/bookvaccine or call 1-888-999-6488. And I can tell you personally, when I went to get my vaccine, I did it to protect my wife, our two young children, and to protect my community. And I would encourage everyone to do the same, to get your vaccine, to protect yourself, to protect your loved ones, and to protect your community. The only caveat that I would say in this sea of good news, because it really is good news that we finally have protection on the way. The commitment right now for the increased vaccine supply to focus on the hotspots is for the next 2 weeks. And it really needs to be beyond that. If we only are able to vaccinate a portion of our essential workers, we're going to be in the same position a few weeks from now. And so I know those discussions are ongoing, but I just want to highlight the fact that that vaccine supply needs to stay stable. You know, we have an opportunity here to put out the fire, to deal with the outbreak in the hotspots, and it can't be a half measure. We need to get this job done. We need to make sure that our essential workplaces are finally protected. In terms of a bylaw update, in the last week we've seen 24 charges, 23 charges under the Reopening of Ontario Act, 1 charge under the mandatory face covering bylaw. And I want to say overall compliance has been very impressive. 99.9% of the public understands you need to follow the public health guidelines because it's out of the best interest of the community and your neighborhood. I would say we did have one incident this last week on May 2nd. There was a social gathering at a business on Steeles Avenue where someone was having a birthday party at a place of work, and a bylaw officer was assaulted. The Peel Police have since charged and arrested that individual for assaulting a bylaw officer, but I want to use that example as a fact that we will not tolerate violence, that our bylaw officers are out there doing everything they can to make sure our community is safe. And for me, it is absolutely offensive that one of these unsung pandemic heroes would be assaulted. And I want to say to Paul Morrison, our Director of Brampton Bylaw, that on behalf of the residents of Brampton, I'm grateful that for these frontline soldiers. You know, these bylaw officers have been pandemic heroes going into difficult situations to make sure that we don't have an environment where the virus can spread rapidly. And so I was dismayed that there was an incident on the weekend, but I'm glad that the Peel Police took no tolerance to that activity, and the person responsible will be held accountable. In terms of a William Osler update, our hospital system continues to be at capacity. And when I say the weekly numbers, it really doesn't highlight the real picture. And I talk about we have 69 COVID-19 patients at Brampton Civic Hospital, 9 in ICU, 43 COVID suspect patients waiting to find out their test results. But what really paints the picture, and I've asked for this data so I can now share it on a weekly basis, is the amount of patients who've been transferred out of the hospital. Everyone knows since the start of the pandemic, our hospital has been full. They've been at capacity, and our frontline physicians and nurses have to go above and beyond to handle the volume at the hospital. But the real figure that highlights the capacity challenges in Brampton are the number of patients that have been transferred out to other hospitals. So just to give you a list, in the last week, there has been 139 patients transferred to other hospitals. Think about that, 139 patients. More than our hospital could handle in totality have been transferred out in order to support the capacity at Brampton Civic. And I want to thank the other hospitals who have stepped up to the plate to help us handle the volumes that are coming out of hotspots. I want to thank the Halton Healthcare Network, Mackenzie Vaughan, Mount Sinai, UHN, Unity Health, Sunnybrook, Royal Victoria Hospital, and a number of others. But those are the hospitals that have stepped up, that have allowed us to handle the healthcare volume that is coming out of hotspots like Brampton. I also want to thank the healthcare heroes that came in from Newfoundland and Labrador. They arrived this week. They have now joined the team at Osler on the front lines, and I know human resources was becoming a challenge. You know, we have exhausted frontline healthcare workers, and this help from Newfoundland is much appreciated, and it goes to show that this is a Team Canada approach, and we need to help each other out. So on that note, I'm going to ask Councillor Santos to make a statement on behalf of our council, because it's First Responders Week, and then we're going to hear from Dr. Lowe.
Thank you, Mayor Brown, and good morning, everyone. Brampton, our city, has been hit the hardest by this pandemic, but it's so important for us to take a moment to show our gratitude to our local heroes who have courageously stepped up for all of us. This month is of great significance to many first responders and the emergency workers who strive tirelessly to keep our community safe. May 1st was recognized as First Responders Day, and yesterday was International Firefighters Day. The City Fire and Emergency Team, led by Chief Bill Boyes, enforcement officers led by Director Paul Morrison, Peel Police led by Chief Nish Dariappa, and paramedics led by Peter Dundas, have been the backbone of our response to the COVID-19 pandemic. As the city's chair of community services, which oversees Brampton Fire and Emergency Services, I want to acknowledge their commitment and generosity in spirit during this long and difficult pandemic, where scenarios are just constantly changing. These first responders have been proactive in supporting and educating our community. Firefighters and paramedics have stepped up to help our vaccination rollout. Bylaw officers and police are on the front lines enforcing rules of the longest lockdown in history. While facing these challenges, they continue to demonstrate optimism and hope by taking time to support the many local food banks and charitable organizations throughout our community. This is the true community spirit in Brampton, our city, one that has been continuously knocked down by this pandemic. It is also Emergency Preparedness Week. At the center of the response to COVID-19 is its emergency management team, who is celebrating their 20th anniversary this year. The city's response to COVID-19 has been a result of the preparation and practice of our staff, together with our partners, largely guided and dedicated Brampton emergency management staff. Coming up on May 10th to 16th is Nurses Week. Nurses have been our brave frontline heroes, making personal sacrifices every day for the benefit of those who need care, comfort, and medical attention. We especially think of the nurses and their loved ones who have paid the ultimate sacrifice during this time and during this pandemic. Lorraine Guovea is a nurse from Peel Region and is one of our local heroes. Her colleagues described her as a fierce activist, loving mom, and admired friend who dedicated her life to helping others. Our nurses are a huge inspiration to everyone, and words cannot express our deep gratitude. We emerged from this pandemic successfully because of all of you. So again, despite the challenges that our city has faced, it is our first responders, bylaw officers, police, nurses, doctors, local heroes who have helped us face these challenges and continue to give us hope. We acknowledge you and thank you. Back to you, Mayor Brown.
On that note, another frontline hero who has been leading the charge in public health is our very own Medical Officer Health, Dr. Lawrence Lowe, for this week's update.
Thank you, Mr. Mayor, Councillor Santos, and everyone. Good morning. This week, Brampton's test positivity is at 18.7%, with a weekly incidence rate of 455.3 cases per 100,000. There are early indications that our curve is starting to bend, but I must reinforce that this trend is early. We have been here before in the other two waves, and we know that we cannot let up. Success depends on continuing to limit our contact and interactions while getting vaccinated more and more, especially as our hospitals continue to contend with hospitalizations, intensive care demand, and the deaths that follow any surge. This week, as Mayor Brown mentioned, we have learned that William Osler is welcoming providers from Newfoundland and the Northwest Territories to support ongoing efforts to save lives and spare families from the impacts of grief or long-term COVID. I welcome these providers to our community, and naturally I wish it was under different circumstances, and thank them for their support. We're also in week 2 of our updated Section 22 order for workplaces and have started to see our workplace closures get ahead of outbreaks of the variants in our community. I do want to thank all of the impacted businesses that have complied with our investigations and have done their part to keep their employees and our community safe. Your sacrifices are helping, and while we are far from the end, we've also never been so close as we continue to vaccinate steadily. Peel's unique situation means that 85, almost nearly 90% of our community lives in a provincially designated hotspot, including all postal code areas in the city of Brampton. Our vaccine campaign continues to administer over 100,000 vaccinations a week across all channels. Every single dose we deliver is going to a resident of a hotspot. We welcomed the province's recent announcement and move to bring 18+ in hotspots to booking, as it allows many more of our residents to access our system and get vaccinated, and bring us closer to the 75% first dose target in our community. If you live in a hotspot in Peel, which includes all of the city of Brampton, now is your time. Please visit peelregion.ca/COVID-19 vaccine to book your vaccination today. If you couldn't get in earlier this week, I urge you to try again. The website is now faster and more appointments are being made available every single day. Also, for those in our community who are still waiting, particularly those that don't live in hotspots, please hold on a little while longer. We are committed to having all of Peel treated as a hotspot, and I'm sure that your time will come very soon. I'm hopeful that in the next couple weeks we will turn the corner on this wave. I know it feels like we have been here before, but this time is different. Previous waves have resolved, but without the protection being offered by our growing vaccination coverage. We must continue to stay patient and kind, limiting contacts a little while longer and vaccinating steadily to get to 75% first doses in our community. International experience shows that this is the surest way to control transmission, reduce mortality and hospital demand, and slowly begin to emerge from this crisis. Finally, I do want to recognize as well Mother's Day on Sunday. I wish to honor all the incredible mothers out there, many of whom are frontline heroes that provide for their families while serving our community every single day. We also know that COVID has robbed us of too many mothers, and I honor their memories. In so saying, I hope that we can all commit to doing our part to stay safe and to get our shots so that this is the last Mother's Day we have to celebrate virtually through a computer screen or phone. Thank you, and I'll pass it back to Mayor Brown.
Well, thank you, Dr. Lowe. On that note, we're happy to take questions. Our first question is Courtney Heels from CP24.
Good morning. This question is for Dr. Lowe. I wanted to ask a little bit about the partial closures at Amazon on Friday. Peel Public Health announced the fulfillment center would be closed. I believe that's the third partial closure there. Dr. Lowe, I'm wondering if you can speak to what you believe might be behind these recent outbreaks and what more could be done to help prevent the spread of the virus in that particular facility.
Thanks, Courtney. I think the closure itself is really what is being used as a tool, and as you know, the variants are traveling further and faster throughout many of the workplace outbreaks that we're identifying. Moving to expedited closure really takes into account that the variants spread much more easily and the need to make sure that we're addressing the issues in these workplaces sooner rather than later. So, in essence, the closure that you are asking about for that specific facility, as well as all the other closures that have been issued, are the control measure, or at least one of the control measures that are being used to address the spread of the virus. Thanks for the question.
Thank you. My follow-up, it's on some comments you just made about the test positivity rate. So you said it's currently sitting at 18.7% and that the curve is starting to bend in the region. What do you think is behind this improvement that we're finally starting to see for your region?
Thanks, Courtney. I mean, I think it really is a combination of all the factors. Certainly, the provincial government's stay-at-home order has been a significant help in reducing discretionary contacts and really driving home the message that we need to limit our contact with individuals outside our immediate household. I think that has helped. Certainly, we also know that the move to virtual school has also been helped, has also continued to help. And then, of course, I'm hopeful that in the next week or so, next couple weeks, we'll start to see the impact of the expedited workplace closures. Really, it falls to all of us, though, to continue to limit our contacts. And now that 18 plus and hotspots in Peel are eligible, including all of Brampton, please, if you're eligible now, make sure you book and get your shot so that we can continue to move forward. Thanks for the question.
Next question is Graham Frist from the Brampton Guardian.
Good morning, guys. How's it going? I guess my first question would be for Dr. Lowe. Dr. Lowe, I'm just curious. Given the current supply and vaccination rates, is it even possible for us to hit 75%, that 75% mark in 2 weeks if this program stops then?
So, Graham, it wouldn't be 2 weeks. It would certainly be by the end of the month, though. We're vaccinating very steadily. I mean, just to give you an idea of how quickly our vaccination efforts have accelerated, to get to our first 100,000 doses, it took almost 90 days, and that was related to supply challenges. In our most recent 100,000 doses, we got there in 7 days. So the reality is we've now delivered 600,000 doses in the region of Peel. We need to get to 1.1 to 1.2 million. We're at 100,000, ramping up to 150,000 throughout the month of May. So if you do the math, we're looking at somewhere in the mark of 4 to 5 weeks. If everyone continues to go there, fill our clinics, if they make use of the eligibility that's available now, let's get our community vaccinated and protected up to 75% first doses. Thanks.
Okay, my follow-up would be, I guess, again, for Dr. Lowe. But given what the mayor mentioned earlier about prioritizing hotspots would only last for 2 weeks. So, I mean, will we have the supply again if after 2 weeks? I mean, is this even possible to hit that mark?
Yeah. So, Graham, it's a great question. I mean, I think certainly we're grateful for the additional supply that's been given for this 2 weeks, and we are working very quickly together with our provincial partners who we're working hand in hand with to make sure that that gets out to our whole community, which is identified largely as a hotspot, 85–90% of our population. Of course, there is more vaccine arriving in Canada and Ontario every single day, and as part of those conversations, we will ensure that we're hopeful that we will get the allocation needed to reach our goals and our targets in working in concert with our provincial partners. Thanks so much.
Okay, our next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. May 20th, the current stay-at-home order expires. That, of course, is just ahead of the May 2-4 weekend. Would you like to see it extended? Are there worries about people celebrating the long weekend?
Well, Irene, I think the most important thing for people to know is that we've never been so close to the end, but also so far. This is really the hardest part of a marathon, the last few minutes of a period, in the third period in hockey. We really need to just make sure that we keep our head up, we keep focused. So regardless of what happens, I would encourage people on May 2-4 weekend just not to gather over the long weekend as we have. I mean, honestly, there'll be plenty of time for people to celebrate once this is over and once we get to 75% first doses. But really, it's a matter of us continuing to. It's really a matter of us. Sorry, there's just a technical glitch that we had here, so I was just trying to make sure we were still on the air. But really, it's a matter of us trying to make sure that we continue to limit our contacts and get vaccinated steadily. Thanks so much for the question.
My follow-up is also for Dr. Lowe. Are there worries about getting to 75% vaccinated, not because of a supply issue, but because of vaccine hesitancy, including mixed messages on AstraZeneca, particularly on a federal level?
Absolutely, Irene. I think it's very important for me, and thank you for asking the question. It's very important for me to reiterate to our community that the guidance from our federal partners speaks to the need to weigh the risk of taking a vaccine with the risk of COVID and the context of the community that you're in. Here in the region of Peel, where your possibility of being infected with COVID and the significant severe outcomes associated with that far outweigh the risks, the rare risks that have been identified with AstraZeneca, our recommendation here at Peel Public Health has not changed. If you have the opportunity to access a vaccine, take the first vaccine that you can get. Our community needs everyone to be vaccinated with a vaccine at this point in time, and leaving yourself unvaccinated and waiting is unfortunately a recipe for potentially being inoculated and possibly ending up in hospital, possibly ending up in intensive care. So I think that's the first thing I would share in respect of our advice. Take the first vaccine you can if you are a resident of Peel. And I think the second thing in terms of hesitancy, that's why we also have our mobile program, which is expanding, getting into workplaces where people can't work from home, and also really targeting the hardest to reach groups. So our pop-up clinics are a little different from other jurisdictions because our entire community is a hotspot. So we're trying to get everyone to go through our mass clinics, recognizing that those kind of function as serving a large hotspot community, but also making sure that we are using our mobile modalities to get to some people who do face some real barriers to getting into our mass vac system. Thanks so much for the question.
Next question is Sabrina from the Mississauga News.
Hi there. So my questions are for Mayor Brown. So how concerned are you about the vaccine supply allocation for 2 weeks, and are you currently speaking with the province to ensure continued supply for Brampton?
Yeah, there's ongoing conversations with the province. I would say the tone is positive and promising, but the commitment right now is for the first 2 weeks of May, and we really need to see that commitment extended beyond that. But it's within the context, I would say, we're having very positive and collaborative conversations, and so I am hopeful we're going to see that extended beyond the 2 weeks.
Okay, so for my second question, I just want to talk about the workers coming in from Newfoundland. Would you say that this speaks to how overwhelmed our hospitals are? And as well, do you know how many workers will be on the ground in Brampton specifically?
So I don't have a specific number of how many will be working at Brampton Civic. I do know they've already started. And yes, I think it's fair to say that a lot of our frontline healthcare staff have been overwhelmed. This has been exhausting for them. And this help is much appreciated. I know there was particular shortages when it came to acute care nurses and physicians, and so I know this has been very welcomed by the hospital. Our next question is Steve from in Brampton.
Good morning.
Morning.
Good morning. The question is for Mr. Morrison. And the question is regarding the circumstances surrounding the recent assault on one of your officers. I know the police have been involved, but can you give us some more details, like where it happened and some of the other details?
Well, Steve, it is an active investigation by Peel Police, so I can give you that we did attend a business on Steeles Avenue, as the mayor had said, for a social gathering. Our officer went to the door. He did encounter some people from inside the building. There was an altercation, and Peel Police were called and attended the scene and subsequently arrested the person that we were dealing with. Any other follow-up would have to be with Peel Police.
Thank you. Next question is for the mayor.
Yes.
Are you satisfied with the sick pay program introduced by the provincial government last week?
Well, let me say it's a step in the right direction. It offers 3 days paid sick leave. It enhances the federal program. Would I prefer it go further? Absolutely. But in fairness, the provincial government just put $2 billion on the table. It's a serious, credible package that's going to help, and we're grateful for them coming to the table. So it's positive, and it'll be an additional tool that we can use to protect our essential workers. Our next question is from Omni TV.
Good morning.
Morning.
Thanks for taking my question. My question is for Dr. Lowe. So, is there any new updates on the new variant B1617 in these regions?
Yeah, so I can confirm that we were advised of 3 cases of the B1617 variant that were identified in the region of Peel. Of course, once we looked into those, 2 of them were actually residents of another jurisdiction, and one of them was actually a temporary person in our city. They were not a resident, so we don't have any residents that have tested positive with B1617 at this point in time. We continue to obviously monitor with our provincial partners. Let me also just say that when it comes to the B1617 variant right now, the B117 variant is extremely dominant in driving the 3rd wave at this point in time and has actually overwhelmed all the other variants to date, including 1351 and P1, and it's likely foreseeable that B117 will continue to be the significant driver of transmission in our community, at least for the duration of our 3rd wave resolving. Thanks for the question.
My follow-up is just for you, Dr. Lowe. So, is there any concerns for the how effectiveness the vaccine is going to be for these new variants?
Absolutely. We understand, of course, that there is a possibility of escape and vaccine escape partial effectiveness with all the different variants, but we continue to monitor the effectiveness of that, and I do believe that there is additional analysis being conducted at the provincial level to determine how effective the vaccine has been given the current slate of variants in Ontario and our community. Thanks for the question.
Okay, next question is from Y Media. Pooja.
Hi, good morning. Thank you so much for taking my question.
Our pleasure.
I would like to know that, Premier Ford has been advocating that international students' arrival should be banned. So what do you have to say on that?
So I wouldn't speak to any specific travelers that are coming in. I would say, in general, I believe we need tougher restrictions on aviation, and at our border I'm concerned about how variants have entered the country, and during the stay-at-home order I don't think there needs to be any international travel that is not absolutely necessary to the COVID-19 response in terms of supply chain, medical supplies. But I'll see if Dr. Lowe wants to add to any concerns he may have with the airport.
Thank you, Mayor Brown. Thank you for the question. Certainly we're trying to bring under control the significant community transmission that's occurring in the region of Peel. As our vaccination coverage rates improve and our transmission rates start to come down, we will start to need to look at international travel and how that could lead to introduction of new variants, et cetera, given that many jurisdictions in the world are still faced with significant challenges in controlling COVID-19. So it's kind of an all of the above situation where you're trying to put together all the different pieces of the puzzle to make sure that we're keeping our community safe. Thanks for the question.
Thank you. My follow-up would be for Dr. Lowe. Dr. Lowe, I would like to know that, the confusion that arose after NACI, saying that mRNA vaccines are more preferred. So what do you have to say on that? Like, should we be given the option to choose our own vaccines, or that option is still not available to residents?
So the NACI statement basically says in situations dependent on the local transmission that the mRNA vaccines would be preferred. However, they did say that in situations where transmission is significant, such as they are here in the region of Peel, that the risks of the vaccine risks with certain vaccine products may be very well outweighed by the benefits that it would protect against people not getting COVID-19. That's our situation in Peel, and so that's why specific to Peel, our recommendation remains get the first vaccine that you can get. We don't have an option of a preference here. It's like if you're significantly thirsty and someone offers you tap water and you say, I really only drink a certain brand of bottled water, you definitely want to make sure that you're taking whatever water you can get at this point in time here in the region of Peel. Thanks.
Okay, our next question is Nitin Chopra from Prime Asia TV.
Thank you, Mayor Brown. My question is to Dr. Lowe. Dr. Lowe, so the people who got the AstraZeneca shot, they are frustrated after the NACI's statement or advice that get the mRNA-based vaccines only. So what message you want to give to those, because they might not come for the second dose? So your message to those who got the AstraZeneca so far.
Thank you, Nitin. For those people who took AstraZeneca as their first shot, thank you for doing your part to protect our community. We know that the vaccine is effective. We know that it is safe. There are certainly very rare side effects, but especially in a context here in Peel, remaining unvaccinated does put you at risk, especially if you're out and about and meeting lots of people, which you shouldn't be, but it does put you at risk of potential more severe consequences. So if you received AstraZeneca, thank you. There are things looking at how people can mix doses later on, and there is also additional AstraZeneca that may be available to ensure that people finish the complete series and ensure that they get the full protection. So that's my message to people who've already taken AZ.
I have a follow-up for Paul Morrison, or Mayor can also add into that. As the incidents happened on weekend in the car garage, as Mayor in his opening statement said that one person was charged who assaulted the bylaw officer. Did bylaw issue any tickets to those who attended, or the organizer or the owner of the garage? If you can give some details on that too.
Okay, we'll have Paul Morrison speak to that.
Thank you, Nitin, for the question. So I can tell you that we are continuing our investigation. We have great cooperation with the Peel Regional Police, Staff Superintendent McKenna, Superintendents Chinsner and Gormley are really supportive of our initiatives here in the city, trying to keep the social gatherings down. So we are talking to them about possibility of additional charges. We didn't charge anyone else at the scene. Most had gone when we had gotten there, but it doesn't mean we can't follow up. So we will be doing that. I can tell you one thing, Nitin, and it really echoes what the mayor says. Our community is really supporting the stay-at-home order and staying safe. We attended 800 calls, both proactively and reactively in the last week, and we really only had 12 incidents out of those 800 calls. So we're doing a good job as a community, and we're trying to stay safe. Thank you.
Thank you, Paul. And we have time for one more question, and then we have to go to City Council. Nikki Cedrone from the Bramptonist.
Good morning. We are finally seeing increased vaccine shipments and availability for Brampton. This has allowed for pop-up vaccines to be added to the distribution chain to help hotspots. There is some confusion about the role of pop-up centers, how they operate, and who can use them. For example, is there a difference between a religious pop-up center and a business one? Can you clarify the role of a pop-up center?
Thanks, Nikki. I appreciate it. Peel's vaccine rollout is unique. It's occurring in a region where 85, almost 90% of the population lives in a provincially designated hotspot. In other jurisdictions, pop-ups are used to head to specific neighborhoods where there are high rates of activity. In the region of Peel, all of our neighborhoods, the vast majority of them, are seeing high rates of activity. So our large mass vaccination centers, which are doing 100,000 doses a day, they're vaccinating 1% of our population, 100,000 doses a week rather, vaccinating 1% of our population every single day. All of those doses are going to people in a hotspot. All of those are going to our residents. And that means that in Peel, our pop-ups look a little bit different. The focus on pop-ups is trying to get to people who actually have significant barriers to accessing them. So we're not doing, like other jurisdictions, a free-for-all, come line up for hours. We're working with our community, we're working with our partners to get to the people who really have significant barriers and otherwise would not be able to access our mass vaccination clinics. So that is the difference, and that is the role of our pop-up clinics in Peel with our unique situation. Thanks for the question.
Thank you. That's all I have.
Okay, well, thank you for tuning in today. That completes our COVID-19 update for this week. Stay safe, stay healthy, and until next week.